to make sure everything's gonna go smoothly here. Oh, usually I wear my earbuds. See, already forgot something. Maybe they're nearby. Shoot. I'm gonna have to go find those suckers. Oh, right here. How lucky. All right, stand by. Gotta put those in. They just help with sound quality. Alexa, turn it down. Technology is cool, huh? All right. So tonight we are joining together to talk about bladder health, and I've done this topic before. Talking about bladder health, I think it's a really important topic, and it's super helpful because people who have any sort of like leaking or retention, there's things we can do which help, all the way from diet, lifestyle, strength in the pelvic floor, relaxing the pelvic floor, breathing mechanics. And I'm struggling to get on the computer where I need to be. Oh, there we are. I need to open up my computer so I can see the comments come in as I'm speaking here. Again, if you're in and you want to say hi to me, please do. Hi, Janelle. So glad you're here. Hi, Kayla. Okay, so really quickly, for all of my spiritual followers or people who like lean into numerology or astrological things or whatever, I wanted to just read really quickly about the meaning of today's date, 11/11. And I thought it was really cool and really coincidental that this is the 11th class, the pelvic floor and core class. On the 11th day of the 11th month, I was like, that's cool. So let me find that fun information. There it is. Okay, y'all ready? So the spiritual meaning of 11/11, it's often called a spiritual portal, a day where energy between the physical and spiritual worlds feel thinner. It's believed to be a moment of awakening, insight, and connection to your higher purpose. So that's kind of cool. If you're feeling like kind of lost or stuck, lean into just being still and quiet and intuitive. The number 11 in numerology is a master number. It represents intuition, enlightenment, and spiritual insight. Doo, 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 doo. There's manifestation energy around today's date, 11/11, and it's a time where you can set clear intentions. The idea is when you focus your thoughts and energy on what you truly desire. So first you have to identify that, right? If you put your intention and energy on what you truly desire, whether that's healing, love, abundance, or peace, the universe will listen more clearly on a day like today, where the spiritual world and our physical world has a thinner veil between it. It's a call to being present. Noticing the state reminds you to pause and breathe and reconnect to your inner self. It's an invitation to trust your path. Oof, that can be hard, right? Super hard, especially if you have this intention or goal or idea or whatever, and you're like, oh my God, how do I get there? Trust you're on the right path. That's what today's about. And intuition is helping to guide you. It also represents a new beginning and transformation. Okay, so today is like a doorway into a new pattern. So you need to release your old patterns, your fears, your limiting beliefs, and embrace a higher version of yourself. I hope you all believe in that because I certainly do. If you don't, that's okay too. No judgments, really, either way. But how to work with today's energy, set your intention, write it down, really pull it in, bring it in, believe in it, identify it, get really strong around it, meditate and journal around it, reflect around what aligns with you and what does not. Practice gratitude. I think we should wake up and be in a space of gratitude all the time anyways. It's the best way to live. It's like a beautiful energy. And once you're there, you're like, oh my gosh, it's amazing. And then start paying attention to signs and synchronicities. Like pay attention to, things that are commonalities, or once you have your intention, like you're going to start noticing what's going to help you move towards achieving your goals and moving into your higher purpose and your higher self. It's but you have to identify it. You have to really embody it and know what that is. And if you don't, again, intuition and meditation help you bring in those ideas. You got to get out of that frontal lobe type thinking, that logical, like, if I can't see it, I don't believe it. It needs to be like scientifically like proven. It needs to be physical. It needs to be here. Like that's what holds us back, honestly. So, anywho, that was fun. I'm actually going to use the energy of today, or just even if it's not something spiritual to you, it is an opportunity to just sit tonight and like get a little clearer on your purpose and your goals. Okay, so let me go back into here we are. Okay. Janelle, all the ones, the 11s are awesome. I know. Oh my gosh, and your cousin's birthday's today. That's so cool. All right, Bobby Joe is piggybacking right or moving us right into the topic of the night. So Bobby Joe says her bladder hates her. She can pee and then go again in less than an hour. Okay. So that is a great transition. Thank you so much for being vulnerable and sharing that. So, hang on, I gotta tell Alexa to be quiet. Stop. Okay, she listened. No, she didn't. Alexa, stop. Okay. Talking about our bladder and everything that goes on in the pelvis, whether it's like reproductive health, urinary health, bowel movements, like not typically dinner time or coffee shop like conversation with your friends, or maybe it is. Like I hope it is. Like I don't know. I'm someone who can talk about that kind of stuff really easily, but I have desensitized myself to it because it's kind of part of my work and what I do to help people. So I have to remember that it can be a really sensitive topic for people. So again, Bobby Joe, I just wanted to give you some credit for opening up the conversation and feeling vulnerable enough and comfortable enough sharing that in this space. And I always hope that the space that I create is a safe space where we can all share and just support and love each other. So, yes. So if you're here tonight, you have interest in your bladder health and what you can do to support it. So this talk is to help people understand their bladder and how it works, recognize what is normal and what is not normal and what might be dysfunctional. Those are really important things to know. Um, so by the end of this session, hopefully you'll have all that knowledge and you'll have a better understanding of your bladder, what you can do to help support it, what might be causing your leaking or your urgency. The goal is to reduce all of that. So basically, this talk spontaneously, I wasn't going to do this tonight, but it was spontaneously sparked by people participating in the 30-day health reset through the Fit Doc strength programming. And this week's habit focus is sleep quality. And some of the people in the program, in the challenge, were talking about how, they sleep okay, but then their bladder wakes them up one, two, three times a night. And honestly, that is common, but it's not normal. And there are things that we can do. So without further ado, let me move into our talk. And we're going to start off just talking about, okay, what is normal bladder functioning? I think it's really important to know what's normal so that you know what you're going through or not. Okay, just need to open up the comments section. All right. So, normal bladder functioning. Your bladder, a healthy bladder, can hold 2 cups of fluid. Okay. And by the time it gets 2 cups of fluid in it, it will start getting sensory signals because that stretch reflex will stimulate the nerves in the area and say, okay, time to go sit on the toilet or go to the bathroom so that we can empty. Because if your bladder just keeps expanding, that's not good. So it can hold up to 2 cups, and normal urination or voiding frequency. So how many times you go in a day is typically 6 to 8 times in a 24-hour span. So I'm curious to all of you. I mean, I don't know if you've ever counted or paid attention to that, but who thinks they're going 6 to 8 times in a day? Actually, let me rephrase that. Do you think you're going more or do you think you're going less? Because there's two different spectrums here for people. Some people go really often, and then some people hold it all day, sometimes based on profession. Some professions, like teachers or hairstylists or people who are just back to back, like can't go to the restroom, they often are not going enough. And that can create problems and dysfunction in the bladder as well. So if you're comfortable in the comments, let me know where you think you're at. Another measurement of frequency that we use is going every 2 to 4 hours. So not going less than two or more, not going more than 2 hours or more than 4 hours or less than 2 hours. Sorry, I don't know why that just completely malfunctioned in my brain. So going every 2 to 4 hours. I'm not seeing any comments come in. That's okay. You don't have to participate in that way. Just hoping that my system is working. Okay, so that's normal, 2 to 4 hours or 6 to 8 times in 24 hours. Now, I had some people say, they go every 1 hour or they are getting up 3 times a night. Like that's three out of the 6 out of 8, 6 to 8 times in 24 hours. That's a lot. Oh, we have some comments coming in. Okay, Janelle goes 4 times, like 4 times a day. Brenda is drinking more to stay hydrated. She's finding she's going more. Bobby Joe says she goes way more and tends to go every hour to hour and a half. Okay, so the next thing that let's continue to talk about normal bladder functioning. So as we get older, especially for women with menopause and hormone changes, the amounts can go up a tiny bit, but seriously, we want to stay within that 6 to 8, maybe 9 times a day. But knowing that with menopause and that happening, like getting up once a night is considered normal. Not ideal. I would love to have people sleeping through the night, but it is more normal to have that happening once you're in menopause. Um, the urge to urinate is just a signal. So you can control the bladder to an extent. Now, again, if it is like overcapacitated, 2 cups of fluid or more, then you do want to go to the bathroom. But if you're not and you're going more often and the stream is not strong, or you're sitting on the toilet or going pee and you're only going for less than 8 seconds, like one Mississippi, two Mississippi, three, okay, and your stream stops, then you're not letting that bladder fill up full enough, or you're not emptying well enough. So there's some strategies for that we will talk about. But what I was trying to get at with saying with that is the bladder is one of the most trainable organs in our body, which is really cool. Because if you're struggling with urge, then we can train it and suppress that urge depending on where you're at. Are you going every 2 to 4 hours? Are you going more? Are you going less? So basically, what you all need to do is get a baseline and kind of keep track of it for a few days. So what I recommend for people doing is creating a bladder log. And what that looks like is you record how much fluid you're drinking. Okay. And then you record every time you go to the bathroom, like write down the time. It was 8 a.m. And then record how long the urine stream lasted. Oh, that one lasted 20 seconds. And I counted one Mississippi, two Mississippi, three Mississippi, or like timed it. And you felt like you emptied your bladder. Okay. Then you would track the next time you go to the bathroom. Oh, it was only an hour and a half later. So it's possible you're drinking or eating too much, or drinking or eating bladder irritants, and your bladder's like, get this out of me ASAP. You're drinking too much, or your bladder is on a habit of going more often, or lastly, you're not emptying all the way. So those are the scenarios if you're going too often. Okay. So some good habits when you do get to the restroom is it's called a restroom for a reason. You're going to want to rest in there. So like I said, some professions they don't have time. They don't give you time, which is terrible and really irritates me. They don't give you the time to go to the bathroom. So you rush in there, you power pee, you push it out. So that's not ideal either. You don't want to power pee. You want to be resting, you want to be deep breathing, you want to be relaxing. Reason for that is the bladder actually has its own muscle system inside of it. So the bladder can squeeze. You don't have to push. You don't have to squeeze. because you have your pelvic floor muscles underneath, the urethra goes through them, your bladder sitting up here, you need to relax those muscles to allow the urethra to open. And then your bladder is just going to be like, and then you pee. So relaxing the pelvic floor, resting in there, sitting with good posture, maybe using a squatty potty, which is one of those things that sit on the floor and your feet are up, opens up that area a little better, puts the muscles on more of a relaxed state. That's what you should be doing when you go pee. Now, there is some situations where your bladder might be a little off, like you might have a tiny, tiny bit of a prolapse, or you might have it sitting back a little bit, creates little pockets in the bladder where it might not be able to come out all the way. So a really good strategy for that to make sure you're emptying after you're all done and you're like, "Okay, I feel like I'm done," is rock your pelvis forward and back. So some pelvic tilts forward and back to see if you can get more to come out, because that will change the orientation of the bladder. Then you can do left and right. Okay. And then the next strategy you can try is stand up, sit back down, relax again, and see if more comes out. Okay. So you want to try and empty it all out, especially if this is your last pee before you go to bed, because we want you to sleep well. I don't want you getting up a million times at night. Um, so yeah, that's what you can try to do. And then, okay, if you are, so for bedtime, let's talk about other little strategies for bedtime. So you're going to do that last pee before you go to bed, right? But the other thing you want to make sure you're doing is not eating bladder irritants or drinking bladder irritants close to bedtime or at all if you're very sensitive. And then you want to make sure you empty all the way. You want to stop drinking fluids 1 to 2 hours before bed. And then lastly, something that's really important is making sure you're not constipated. Now, that's important because the rectum sits right next to the bladder, okay? So if you're constipated, this rectum's going to swell up and be full of stool, and that's going to be pushing on your bladder, which will decrease space in the bladder, which will signal the bladder that it's more full than it is, which will signal you to have an urge to go to pee. So, what a convoluted thing, right? Work on your bowel health and constipation, or reducing or having no constipation, to help your bladder not be overstimulated and can react how it's supposed to. Does that make sense? I hope so. So that's another strategy to help with your bladder and making sure that you're not leaking or getting up at night to pee. Um, okay, so I've mentioned bladder irritants a few times. Let's talk about what those actually are. So, some bladder irritants for some people are caffeine, alcohol, citrus, vinegar, tomato-based things, spicy foods, artificial sweeteners, carbonated drinks. Those are the main ones. Those can irritate the bladder. Now, if the bladder is irritated, it's gonna be like, get this out of me. It's like toxic. It doesn't want that in there. So it'll signal you to go to the bathroom, even if your bladder isn't full. So it's really important to pay attention to maybe your bladder gets irritated by something specific. That's where bladder logging comes in and is very helpful. So you can get more specific on your bladder log and say, okay, I drank orange juice and then I had a coffee. Then I had to pee 4 times before 11 a.m. That might signal us to say, okay, caffeine, which is a diuretic, which actually does make you go pee more, might be causing the excessive amounts of urination. So that's important. Um, in terms of how much to drink, usually what we recommend is taking your body weight and drinking half your body weight in ounces of fluid. So if you're 160 pounds, 80 ounces of water is what you're aiming for in a day. Now, you don't want to drink nothing all day and then catch up at the end of the night. Oh my God, Kayla said I need half my body weight to be hydrated. I'm going to drink it all at dinner time. No, that's going to cause you to have to pee multiple times at night and increase your urination. Your bladder's not used to that. It was like, oh, I was small and not hydrated all day. And then boom, I'm going to drink 80 ounces of water. You're getting the point. You want to drink throughout the day steadily. Okay. And now, if you're someone who weighs more than 200 pounds, 100 ounces of water a day is a lot. So we recommend sticking to like the 8 to 10 cups of water a day if you happen to be more than 200 pounds. Okay. All right. So let's talk about bladder suppression techniques. So if you're going really often and you need to stop that, there's some strategies you can try. Okay. The very first one you want to do, if you're getting the urge and you're like, oh my God, it hasn't even been 2 hours yet, you want to sit or stand, be still. Okay. Then you're going to do some deep breathing. You're going to try and distract away from that sensation. And then what you're going to do is focus your attention on something else. Maybe you have to count backwards. Maybe you have to recite the ABCs, count the sheep if you're asleep, if you're in bed, something that distracts you. Okay. The next thing you can try is doing 6 to 10 pelvic floor contractions. And these look like quick flicks. And what that means is you contract, relax, contract, relax, contract, relax, contract, relax. So what that does is it stimulates the nervous system in a way that tells the body that, no, we're not going to be letting go and letting pee come out. So it changes the stimulation in the area. So that's a really helpful strategy is doing quick flicks of your pelvic floor. And then another strategy, this one is funky. It's like, why would that help? You're going to do ankle pumps. So pretend these are my feet. You're going to activate your calf and then relax. Activate your calf and then relax. The reason that's a thing, two reasons, it's a distraction strategy. Your body's like, oh, we're contracting muscles, cool. But also, the nerve that stimulates the bladder and goes to that area also has branches that go to your calf muscle. So, because it's the same nerve, by distracting the nerve with calf contractions, it's going to take away from stimulation and sensitivity at the bladder. So that's a really neat kind of thing to think about. It's like, oh, if that nerve is busy activating a muscle in my calf, then it won't be stimulating the bladder or paying attention to that. Is that the only thing? Let me think real quick. Oh, another strategy might be a little strange, might be the last one you try, is you can put pressure on the perineum, which is the soft tissue area between the anus and the vaginal opening for a female, or, between the testicles and the anus for a male. That area, that soft tissue area, if you put pressure there, that can reduce the urge to go to the bathroom. Okay. So those are the main things. Let me recap as best as I can. Normal bladder health. Going to the bathroom 6 to 8 times a day or every 2 to 4 hours. Drinking half your body weight in ounces throughout the day, not loaded at the end. 8 to 10 glasses of water, cups of water if you're over 200 pounds. Avoiding bladder irritants, coffee or caffeine, alcohol, spicy foods, citrus, vinegar, tomato products. Um, Bladder suppression strategies, retraining the bladder, trying not to go just in case. Just in case peeing actually creates a habit in the bladder. So if you don't have to go, don't go just in case. If you have to go, like try your bladder suppression strategies. Unless, again, if it's within that normal range, then definitely go to the bathroom. But the bladder logging is really important, gives you information, it helps you determine what you need to do. So that's where I would start for all of you, is just doing a bladder log. And again, what that looks like is tracking what you eat and drink, when, when you go to the bathroom, how many seconds it takes to pee without power peeing, so no pushing that pee out. Um, and then just repeating that throughout the day and seeing, okay, yeah, I did only go 6 times a day. Like, that's not bad. But right here, after I had my orange juice and coffee, I went 3 times. Okay. So picking up on patterns is helpful. Okay. Oh, and making sure you fully empty, going to the restroom and you rest. Okay. Making sure that bladder gets fully emptied. Um, yeah, your bladder is the most trainable organ in the body. So definitely start with these strategies. Now, this is a blanket kind of talk. People are different. There might be other individual needs for people, but this is for general, health and wellness for people. So yeah. Um, this is a really important topic, though, because there are people who avoid exercising and avoid other things because they're afraid of leaking. They don't have control over it. So that's this element of like lack of confidence in themselves. So this is a an important topic, and I'm glad that in the group, in the 30-day reset, people were openly talking about this because I think it's a good one. So I'm gonna give 5 minutes to open up talk or questions or anything you all might want to mention, or if you need any more clarification, let me know. And then in 5 minutes, we'll move into our exercise class for the pelvic floor and core. Mm. Okay, so I was just reading Bobby Joe's comment about um, the peeing or leaking can be worse if she lifts a 50-pound bag. Um, yeah, that's a pressure management issue and maybe pelvic floor activation or coordination issue. So, what you would want to do is, well, it's tough for me to say completely because it might be that your muscles are already too tight. I'm not sure. Tight muscles are weak muscles often, but before you go to lift something, contract. It's called the knack. So you would use the knack before you laugh, cough, sneeze, lift something heavy, step down a curve, anything that has force translation up through the pelvis or increases intra-abdominal pressure. You want to start retraining those muscles to activate at the right time. Your pelvic floor muscles are anticipatory and they should be doing it on their own, but sometimes you have to retrain them and create habit in those. So anytime you feel like there's a time where you might leak, you want to really like contract your deep core and your pelvic floor. So doing this class with me next would be helpful. I guess I'm a fidgeter. I didn't realize like while I'm talking, I've been playing with this little book the entire time. I guess it helps me. Too funny noticing our little mannerisms. I also realized I said okay quite a bit. Better than I guess. I do say quite a bit. Does anyone want to share their intentions they're going to set tonight with the 11/11 date? That could be fun. How are we going to move into our higher selves? How are we going to move forward in life with gratitude and limitless potential and our most authentic self with our most purposeful journey? It's hard to figure out what lights you up, right? It's hard to find your purpose. This is my purpose, helping you all. Um, yeah, I feel very compelled to be able to share knowledge and help and use this platform for that. So I'm grateful for social media to be able to connect with you all. Um, oddly enough, I don't have a great income coming in right now, so in order to keep this passion and this purpose alive, I need to figure out how to make some money. That being said, I do this for free. I do this for donations, essentially. So if you feel compelled, I do have a Venmo, and I don't need you to do that. But if you feel compelled and appreciate my knowledge and want to support me in any way, I am grateful for anything that you want to offer. My Venmo is just my full name without spaces, Kayla Mabzewski. You'll see a picture of me. I believe I'm wearing glasses and a green shirt. Um, okay. Bobby Joe says doctor diagnosed her with adenomyosis today after your surgery. Yeah, okay. So I don't know if that causes any of my bladder issues. I just know sleeping all night would be amazing and not peeing yourself. Oh yeah, totally. Um, that is when you have like extra uterine tissue growing inside the uterus. I don't know if they found it elsewhere. Can be pretty painful. So I'm hoping that, after your surgery today, that's going to be better for you. If your body has been, pain can turn muscles off. So if you've been suffering with pain in that area for a long time, it's quite possible your poor pelvic floor muscles have been kind of turned off. And the stage of your life you're in, and if you're postpartum, once you've had children, you're always postpartum. That is part of you. That is an identification that you are. It's not like after 6 weeks you're not postpartum anymore. That is a thing. So, yeah, I'm hopeful for you too. I'm hopeful that if you reduce your pain, you're going to be able to control that area better. hmm Thanks for sharing that. Gosh, my heart is sad for a lot of women who have been going through a medical system that has not supported them for a really long time. But we are tip of the iceberg. We are breaking through, and I'm seeing some really good things, and I'm really hopeful for our future of women going through the healthcare system and how many passionate leaders there are right now. It's beautiful. Janelle says 1111 is working on my mirror dysmorphia body syndrome and building your business plan. Heck yeah, that's powerful. Let's go. I love that. Thank you for sharing. I think that's incredible. I know that you're going to make that happen. Really sit down and meditate on that tonight. That is cool. I know some of you are joining for just exercise tonight. So if you're jumping in late, not late, you're on time for exercise. But if you're here after the talk, please say hi. Is anyone new jumping in? Happy you're all here. We did a little talk about the symbolism and spiritual meaning of 1111. So it's about setting intentions, manifesting your dreams, moving into a higher self, using it as a day to kind of to find all of that. So, Janelle, thanks for sharing. That's beautiful. Okay. Well, I'm going to move myself to where I can start exercising with you all. I hope y'all are going to join. Ooh, I look tired without my glasses on. I've been staring at a computer most of the day, and not that you care. I don't need to justify my tired eyes. Okay, let's move. Go into a new space. I do not have a t-shirt on under this fleece, so exercising, we're gonna get warmed right up. Okay, gotta move ya. Hopefully you don't get motion sick here. Hello! New space, new setting, feng shui. So that's something I like to recommend. Again, fidgeting. Ella's toy, elephant. Ella's toy, elephant. Um, I like to recommend people who are setting up an exercise space in their home to make sure it's a separate place where you don't do other tasks. So, for instance, setting up your exercise in your bedroom is something I really discourage because you don't want a place of rest to be a place where you're being energized and exercising. Like, no, their feng shui energy is really important. Janelle, go pee. We'll be here, girl. Aw. If you come in and you're doing exercise with me, say hi. This is great. But after talking for an hour, I'm gonna need some water. It's kind of like what happens when I do a full day at a clinic and work with people all day. I'm such a talker and I'm such an educator. By the end of the day, I'm like, done. No more talking. I don't want to. My poor future partner. So, 11th class, pelvic floor and core class. 11th class. I cannot believe that. How does that happen? So, last week we started getting into a little bit of plyometrics. So, tonight we're going to repeat a little bit of what we did last time. We're going to progress some of those exercises, make them a little more challenging. And then we will end with more plyometric type stuff because that's really important for your pelvic floor and everything. So, let's all join each other and start with our breathing warm up. You're going to lie on your back, knees are bent, relaxed position. Got to let go everything from the day and release the tension in the pelvic floor. I will lie down with you 1 second. I just want to make sure that anyone who's new in here is all set. Okay. Oh, lay on your back, knees are bent. Let's talk through the breathing strategy. And if you're a veteran to this program, you know what you're doing. This is always our warm up. If you just laid down, I'm sure your animal that you own just came and joined you. Let's see, what do I got? She brought me a chick. It's pretty cool. Okay, so breathe, breathing. You're gonna do a giant inhale, expand through the entire rib cage. Your rib cage is a 360 bone structure. So you need to breathe into all aspects of it. You don't want to arch away from the floor. You're actually breathing into the floor, expanding out into the ribcage and forward. Your belly will get big. Let it get big. It's really important that you allow that space to happen, that stretching to happen. You're trying to let go of your pelvic floor, let everything in the pelvis relax on your inhale. What a powerful thing. Breathing in all that beautiful oxygen, fueling the cells, rejuvenating the body. On your exhale, you are going to pull up into your pelvic floor, little Kegel action there, and you're going to pull your belly button towards your spine, breathing out all of the air, really pushing it out. The rib cage comes down and in. You're going to practice that for another 2 minutes. You're going to inhale, expand everything, let it go. Be modest and humble, get as big as possible. Kind of barrel yourself out, expand, let go. It's like a rubber band effect. The more you stretch the rubber band, the more it can contract, and that's what we're looking for. I still have a chick on my belly. That's actually great tactile feedback. Breathe into the chick. Exhale, pull the chick down. Pelvic floor comes up and in. Big inhale, expand, expand, expand. Exhale through pursed lips. Pull everything in, contract. Now, you're not doing this all out contraction. You don't want to pull as hard as you can because that's going to get your hamstrings to fire, adductors to fire, your glutes are going to help. You want to get pelvic floor, deep core, core set muscle. Pull it in. Let's do 3 more on your own breaths. Big inhale through the nose. That humidifies your air. It's better to breathe in through your nose for that reason. Exhale through pursed lips. Pelvic floor, deep core, blow it all out. It's like you're wringing yourself out. Couple more. Beautiful. We're going to move right into cat cow. So flip over roll onto your side, push up onto your hands and knees. If you can't tolerate hands and knees, I will show you the modification in 1 moment. But for those of you who are hands and knees, hands are directly under your shoulders, knees are directly under your hips. You're going to exhale right into cat, inhale into cow. Exhale into cat. Push your spine up and away. Drop your head. Let it be heavy. Tuck your tail. Inhale into cow. Drop that spine between your shoulder blades. Reach your chin up as far as you can. Feel that stretch in front of your neck. Exhale back into cat. Inhale into cow. Sorry, Ella's squeaking. So if you're sitting and you can't tolerate cat cow, you're going to do this cat and this cow sitting in a chair or sitting on the floor. Keep rotating through that on your breath and your pattern. I don't have a hair tie with me. Hi, beautiful girl. Hi, baby. Ella is very present in this video today. Oh man. Okay. Beautiful job. Okay, this one is new for everyone who's been following along. It's a little more complex. So what you're gonna do, and well, this is the if you can kneel, this is the version you're gonna do. You're gonna be on one knee. You're gonna have your leg out straight. We're gonna get a big adductor stretch. And then what you're gonna do is you're gonna rotate and touch toward that leg, sitting your butt back. And then you're going to inhale, come up, exhale, inhale, come back up, exhale, reaching, sitting back. You're going to get a big groin stretch, and then you're rotating through your mid back and thoracic spine. Now, if you cannot tolerate being on your knees, feel free to do butterfly stretch. It's an adductor stretch, and then you can work on rotating. Okay, but do 6 to 8 on each side. Inhale, exhale. Yeah, that's a good stretch. I don't know about all of you, but I get real tight through here. Super annoying. But we keep moving. Don't let it stiffen up. 6 to 8 on that side. Hi, sweetheart. Want to come around and say hi to the people? Okay, let's move into bird dog. So we're going to work on activating our glutes, stabilizing our core, getting a little balance action in there. So you're going to be hands and knees. Oh, someone's being needy right now. Excuse me, baby. Hands and knees. And bird dog is reaching one arm out. The opposite leg extends. Looks like this. I don't have enough space. I hope you all can see that enough. Now, the goal is your core is strong and stable. Your stationary leg, your hand that's on the ground, those are active and pushing into the ground. You're going to bring it back down. You're going to alternate control, slow, intentional. No arching excessively through your mid back because that is a lack of abdominal control. You're staying stable through here. Your spine is neutral and level. Keep alternating, focusing on control. Don't let yourself rotate. Hold your balance. Really pull that belly button in towards your spine just milliseconds before you lift your leg and your opposite arm. Now, if you cannot do this and you're sitting in a chair, what would that look like? I think I would have you do on your back a dead bug. So let me just show the people. Keep doing your bird dog for those of you who are doing it. Dead bug is opposite arm and leg dropping. So those are your two variations there. Let's have you do one more on each side. Okay, and then I'll have all of you join me on your back. We're going to do some crunches, which is not something we've been working on very much, but I want to talk a little bit about what you should see and notice in your crunch to make sure you're doing it correctly and managing your pressure correctly. I'm going to try really hard to show it. Um, so there's something called, we like to call it the bread loaf. So when you're not managing the pressure correctly in your abdominal system, what will happen is when you go to like crunch, you might get this like pooching up in the middle here. Like it'll be like this distance down the center of your abdomen here, and you'll see this like bread loaf appearance. Let me see if I can make it happen. It's hard to untrain it. But what I want you to pay attention to is that happening to you when you do a mini crunch. So the mini crunch is going to be just lifting your head up enough so that your shoulders barely come off the ground. Now, prior to doing that, I want you to really get the whole system ready and engaged. So you're going to, on your exhale, you're going to pelvic floor contract, you're going to pull your deep core in, and then you're going to lift up. Inhale, lower. Exhale, pelvic floor, deep core, belly button in. Lift, pull those ribs in and down. Let's have you do 6 more. Inhale to set. Exhale, pull pelvic floor in, deep core in, lift. Repeat. Inhale, exhale, lift. It's almost like you're tucking your chin and then you're rolling up one vertebrae at a time. You really want to think about pulling that all in together. You don't want to see like the separation. Let's see if I can show you. So you don't want to see the separation happening um, through here. You want to make sure that you're able to pull this all in together. Because if you're not able to, you're going to get that puffing out through that linea alba right here. It's just an area that often you see it after pregnancy. It's that diastasis recti. Babies have it. But yeah, you want to really pull in. And if you are getting a puffing out of that area, then you're not managing your pressure and you're not able to get your deep core to activate. So then we would regress you and we would avoid doing exercises that increase that. Okay. So if that is happening during the crunches right now, strategies for you would include rolling onto your side and pushing up, not doing sit-ups or crunches, because every time you do that, you're putting pressure through that really um fragile, not fragile, that's not the right word. Your body's not fragile. Slightly dysfunctional in the moment area. We don't want to put extra pressure through there. So pay attention to that. And if that's happening to you, let me know after class. We can talk a little bit more if you need to. So that's your crunches. All right. So let's move into our more compound movements. We're going to stand up and we're going to go into our squats. We're going to do a sumo squat tonight because we stretched out our groin. So we might as well continue that. Oh, I got to move you all up. Move you all up. A little higher, a little bit louder now. Don't ask me why that song came into my head. Yay, Meg's here. What up, girl? Thanks for saying hi. We're moving into squats, so come join us. Okay, sumo squat is, if you've ever seen like a sumo wrestler, I've never seen one in person, but they do this whole thing, right? Before they run at each other and like wrestle. So it's called a sumo squat for that reason, because you're wide. And the technique here is your knees are going to follow the direction of your toes. You don't want the knees going in. You don't want the knees excessively out beyond the toes. That's really hard to do. So if you can do that, let me know. But your knees are going to follow your toes, and you're going to get a big stretch through your groin, through the pelvic floor. So you're going to inhale as you lower. And then exhale, groin muscles, glutes, Kegel, pelvic floor, pull up and in on your exhale. Inhale, lower, stretch, 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 stretch. Exhale, pull things up and in. Now, if your knees are bugging you a little bit, do a more shallow motion for now. Let the tissues warm up and then play around with what you can do. How low can you go? Now, side angle here. You want to make sure that you're really sitting back into it. Okay? You don't want to like tuck your tail and go straight down. That looks freaking weird. You want to really sit back. Okay? And if you want, you can use your hands to like guide yourself down into it. Then you can do like a twerk. Oh, God. Okay. Continue. Let's do 5 more. Gotta have fun when you can. That was my grandfather's favorite saying, and I think that I am going to continue it. because it's so perfect. You gotta laugh at yourself. You gotta enjoy life. Inhale down, exhale, pull it all up and in. Beautiful. Two more. Oh, we're gonna get a little more dynamic right here. Hope y'all are ready for this one. So we are going to do a lunge with a knee drive. Okay. So you're gonna lunge backwards with one leg, and then you're gonna come up, exhale, drive that knee up. Lunge back. Now, if you need to hold something, you can. Exhale, drive that knee up. Inhale, lower. Exhale, drive that knee up. Hold on to something if you need to. I want you to do 10 on each side. And what it looks like from the side is it's not a huge stretch lunge. Like I'm not reaching back as far as I can. We're doing a power lunge, which is a 90-90 position. The front knee's at a 90-degree angle, the back knee's at a 90-degree angle, and you're dropping into it like that. 90, 90. Not super extended. That's a stretch. Okay. So dropping down, being powerful and strong, and then exhale, pull it on up and in. Okay. 10 on each side. I forgot I was wearing my mini Tonka slippers. So fashionable all the time in these videos. I didn't put on my Fit Doc tank top because I was a little chilly. It's like the winter wanted to come and surprise us so quickly, huh? So once you've done 10 on each side, take a little break. Woo, that can get challenging after a while. So let's go back a little bit. Let's separate this. I want to just separate this knee drive motion. If you have tightness in your pelvis, maybe your hip flexors or your glutes or something, you might end up doing something where you're excessively like arching like this, or you might be like leaning backwards to get the knee higher. You want to be neutral. You want the motion to come from that ball and socket hip joint. And that's where you're getting core stability. That's where you get to work on your abs, your pelvic floor. Okay? So make sure that when you're driving that knee up, you're not leaning back to get it up. Okay? That's using momentum. And that's using literally like if I stayed like this and leaned back and didn't like lift my leg, it just looks like my leg's going up. And that's not using the hip joint. So you want to be stable and strong through here. And the ball and socket of the hip joint is what's moving. Okay? Very good. You all are amazing. We got for time. Okay, we're gonna move into our plyometrics. So last week we started with just like a simple up on the toes, dropping down. So if you want, you can warm up with that because that's gonna get your pelvic floor to respond and react. Because every time you land, it's anticipating that your intra-abdominal pressure increases and your pelvic floor needs to resist that. It's like gravity, speed, and force and organs pushing down on your pelvic floor. That poor system has to work kind of hard. So if you want to drop heavy into your heels and just like wake that area up, getting ready for plyometrics, please do that. Plus, we get to use our calves, which is good. Being tall, I never like had to learn how to like jump really well in my sports. So believe it or not, my calves are not very strong. They get tired really quickly. Wah wah. No excuses. I could work on them more. And actually I am. Because I finally am like, okay, I need better calves. Okay. So next what we're gonna do is we're gonna move into some light jogging in place. Now, if you can't jog in place, you can like quickly march, or you can add a little bit of motion and speed to it. So jogging in place, whatever feels right for you. Do it for about a minute. Told you it's gonna get hot in this fleece. Woo. It's so dang cute though. This thing was like $7 last year at Label Shopper. I think it was last year. best $7 ever. It's so soft. The only problem is, like, I'm so tall, like, the arm length is almost too short. Oh, God. We all have our own struggles. I hear all the time from people who are short. They're like, well, at least you don't have to hem your pants. I'm like, well, at least you're not always expecting a flood. Funny. Okay, take a break. Nice. Definitely warmed up now. All right. So now we're going to do something a little more challenging. We're going to start jumping. Woo, that's good. 11th class and we're jumping. That's great. All right, so what you're going to do is you're going to what we call preload. We've been working on squats. You're going to inhale and then exhale, jump forward. Inhale, exhale, jump forward. Now, as much as the preload is really important, the landing is the same but fast, right? So as you land, you're like cushioning yourself into the same position you started in. So it's this shock absorption. Because if you did this, ready? You jump and you just, that's so much force that goes up your system. It's going to be harder to manage. But when you hop and jump and cradle yourself down and you have soft and quiet feet, the whole system is less shocked, less pressure, less force. So it's really important that you get a good spring load. Now watch where the motion actually comes from. A lot of the power is from your hips. So you really sit down and you're going to inhale, exhale, squeeze your butt, soft landing. See how the knees were nice and soft? It's almost like you're hanging out with a bunch of dogs. You ever have to do this? We're like soft knees, like athletic, ready to move. Like if that dog is going to run into your knee, like you're going to be able to absorb shock and you're not going to be like locked out and they go bam. Oh, there goes your ACL or meniscus. Ella's looking at me. She's like, I would never do that to you. So spring load down, inhale, exhale, forward, jump, soft landing. Inhale, exhale. Come here, babe, come say hi. Good girl. Keep going, everyone. Maybe 3 more. Really practice that landing. That's super important for shock absorption. Quiet. It's almost like when I'm training someone in the clinic and they're like, bam, and you can hear them stomp. I'm like, quiet. You want to land like really soft. A lot of people, what they'll do though when they land is they'll stay on their toes. Mm-mm-mm-mm. You want to like ease into the whole foot and sit back into it. Beautiful. Okay, one more. I thought we were gonna run out of time. So this was like my backup one. We're gonna do mini lateral skaters. Small, really small tonight. So what you're gonna do is you're going to lift the leg in the direction you're gonna go. So I'm gonna go to my right, which might look like left for you all. You're gonna hop and land, and you can use your other foot to kickstand it. So same thing, you're easing into that. You're being really quiet. Hop, small, land, small. So you're really sitting into it, pushing and landing. I'm actually kind of saying small, like someone who's skating or skiing, right? So really small. If you cannot tolerate that hop, what you can do is just like side to side knee kicks or butt kicks. So continue your lateral hops. Do 3 more in each direction. Cradle it. You can, like I said, land and use your other foot as a little kickstand if you need to. I use my arms for a little bit of momentum too. But like I said, the motion's really coming from driving through the hip. Maybe it's unfair because slippers are nice and quiet. Okay, let's spend let's spend 2 minutes on the floor together, just kind of letting go of the day. So I want you to turn your lights down real quickly. Make it nice and calm, peaceful. Lay on your back. What is this called? Shavasana? Shavasana. I think I remembered. And you're going to lay on your back like you're in a star. Ooh. Okay, I'm gonna walk you through a really quick body relaxation. So no big lights in your face, nice and quiet. We're just gonna tune into our body and let things go segmentally. So I want you to take a couple breaths in, out, really blow away any of that tension, negativity, junk from the day you don't need. Literally watch that float away. Imagine all of that floating away on your next exhale, drifting off, leaving you, going super far. You can't see it anymore. It's gone. It's over with. The day is coming to an end, and none of that serves you anymore. Big inhale, and with that inhale, you're feeling this bright golden light come through your body. You're feeling it go down through your throat, into your chest, out to your arms, to your fingertips, down into your stomach, your pelvis swirling around, moving into your thighs, your knees, all the way down to your feet and into your toes. That energy that's swirling around is coming back up, gently bringing all the positivity with it to each little cell in your body. As it passes through your toes, they relax into your feet. The tension lets go. Your legs sink heavier into the ground or the floor. You really feel yourself grounding more and more into the floor with your heavy legs. Your pelvis is your root. You're feeling that really ground down. Very heavy, very connected. That golden swirling energy is continuing to move up into your stomach, relaxing you, allowing you to let go of everything in that area. Swirling around, bringing so much joy and light and happiness to your core. Moving up to your heart, doing the exact same thing. Mm. Surrounding your heart with love, warmth, safety, gratitude. Mm. And continues out into your arms, reaching your fingertips. Feels warm and welcomed. Moving up into your face, you let everything go. There's no tension in your eyes or your forehead. Your tongue is just there, resting where it wants to be. Your throat is open, open to having a voice, listening, receiving, speaking, being, and continues up into your head, your brain, your skull, reminding you that you are light, you are energy, you are worthy, you are a being of this world full of positivity. Big breath in. One more big exhale, as big as you can. Make it audible. You did it. You showed up for yourself. You completed this day. You feel proud and appreciative of yourself and what you do for yourself to continue to grow and be better. When you're ready, roll onto your side, push yourself up to sitting. I look dead in that video. That's funny. And join me. That was nice. I liked that. I hope you enjoyed your evening with me. I always enjoy it with you. I would love to hear comments or see your comments in the comment section. Let me know how you're feeling. What was challenging? What'd you like? Do you feel good? I love that little somatic like release. Oh, feels so good. There's something really powerful about visualization and just like giving yourself a moment to tune into your body. Ella, come say hi, baby. Yeah. This is my girl, my little love, my best friend. If you follow me, you know that. I'll stay on for another minute or so. I hope you all are feeling really great and find a moment tonight to write down your intentions for the 11/11 day. Just use it as an opportunity to reflect on your life. And hey, you could even use it to um, set an intention for the rest of the year. This year's coming to an end quicker than we know. It's crazy. I think I see some comments. Okay. Meg says, thank you, Kayla. Love that Ella brought you an emotional support stuffed animal. I know. I had her monkey sitting on my pelvis the whole time, which is kind of interesting. Pelvis has a lot of symbolism too. So maybe that's where she thought it needed some support. I need to get grounded and rooted. Janelle says, jumping is challenging, but 5 months ago couldn't jump or skip or hop or stand on one foot. Hey, you can now. Yay! We celebrate all the wins. There is never a win that's too small. That's a beautiful one. Thank you for sharing that. Brenda says, thank you. Always feel great after class. Have a great night. You too. Oh, good. Yeah, that was perfect, Meg, right after a workout. Good. So glad you made it. Well, 12th class is what I promised 12 classes, and that's next week. I will consider doing a 13th class. 13 is my favorite number. And I think that would bring us to the week before Thanksgiving, which would be kind of cool to do. But I'll let you know. But I'm happy you're here. And if you have any friends that you know that could benefit, send them to the group, tell them about it. Um, yeah, I'll see you all next Tuesday at 6:30. Have a beautiful night.